Alright, we're doing video assessment 45. I have Billy here. He's playing the role of Jason. Now, Jason has had a shoulder injury occur 9 months ago. He has torn or ruptured his infraspinatus and teres minor muscles. The injury occurred 9 months ago. Surgery has been 3 months ago and has been doing physio for the last 3 months. He has been referred to me for an exercise regime. Now, Jason, what has happened is the physiotherapist and your doctor have given me a couple of pointers just to let me know that you now currently have high blood pressure, and you have, since your injury, put on weight, so about 15 kilos in the last 9 months because you have been unable to exercise. Now, on top of this, the physiotherapist has prescribed these following exercises to increase the strength of your back muscles, so in particular your teres minor and your infraspinatus muscles, because we need to make sure that those muscles specifically are strengthened because they have recently been injured. So seated row and external shoulder rotation. Now, with your blood pressure increase and increase in weight, we need to make sure that we prescribe particular exercises that don't further exacerbate those conditions. So we're looking at the blood pressure. We need to make sure that we don't do really high weights and low reps, because that's going to further increase our your blood pressure. Having said that, we do also need to prescribe exercises that will help you to lose weight. So what I've done is I have put together, with all of this information and also based on your pre-exercise screening, a weekly exercise plan that will help you to achieve your goals without exacerbating your condition, in addition to a specific resistance training program which will help to increase the back muscles as well as overall muscles, specifically the legs and glutes, because those larger muscle groups working that will help you to lose the weight. Okay. So your weekly exercise plan is following the Australian guidelines of 30 minutes a day on most of those days. So 1, 2, 3, 4 of those days you have the 30 minutes of cardio. Now you have the option of doing bike or the rower. They're the two that I have prescribed. Now you can also use the treadmill. I would stay away from the cross trainer though, because you're using the arms probably just a little too much. We don't want to increase the pectoral muscles. We want to really focus on the back muscles. So for the cardio, try and use the rower. The bike will help as well, but you can also use the treadmill. Down here we have a couple of 3 times a week, if you can manage it, doing your resistance training program. So here we have the resistance training program developed for Jason. Up here I provided the warm-up, which will be your treadmill for 5 minutes. Now the only reason I prescribed the treadmill at the top is because you also have your cardio down here, which I prescribed as the bike or the roller. So this just will keep you motivated in terms of having the different cardio machines to use. Down here we have the exercises specific to your goals. Now we have squats, seated row, lunges, external shoulder rotation, lat pull down, which has to be supervised, and crunches. Now all of these you'll be doing 3 sets. We're going to start at 3 sets, but we can increase you to up to 5 sets if we need to. And as you increase in fitness, we need to make sure that weight stays below 65% of your 1 RM or 1 rep max, and that is so that we don't increase blood pressure. Your reps will be between 15 and 20. Again, that's looking for your overall toning and endurance, not looking at the strength training. We need to make sure that we are looking for the strength and endurance there for those muscle groups. With 2 alterations there. For your external shoulder rotation and your lat pull down, I've only got 12 to 15. Now that's still in the prescribed rep range with regards to toning. But we just need to make sure that we don't overdo it with the teres minor and infraspinatus. And because the lat pull down needs to be supervised, I have also only put 12 to 15 there. Okay, now squats and lunges, those in particular will work your quads, so your thigh muscles and your glutes, your butt muscles. Those are the largest muscle groups of the body. Working those is going to help you to lose weight. Okay, and that also having stronger leg muscles is going to help you to push further when you do your cardio, whether it's on the treadmill or on the bike. Your seated row, your shoulder rotation, those ones have specifically been prescribed by your physiotherapist to help strengthen up the back muscles. And I have put the lat pull down in there because the latissimus dorsi, which is the largest muscle on your back, that needs to be strengthened as well, and will really, again, help to, because it's the larger muscle group, help to lose that weight and also strengthen up the full, all of those back muscles. Crunches is going to help in that core. So because you've put on, like you've had that weight gain there, we need to focus on the core. We don't want a strong back and then that be exacerbated by a weak core. So we need to make sure we have a nice strong core all the way around, and those body weight crunches there will help you to do that. Now, because you are a moderate risk client, and that is because of the injury, your current weight and your blood pressure, you are only prescribed light intensity cardio. And to really work into those legs, I've got the bike there. 20 minutes should be fine, and that's continuous. So not interval training, you're just looking at that continuous cardio. About 60 to 75% of your maximum heart rate. So I've calculated that there is between 112 to 140 beats per minute. All right. The rower there I have included to help strengthen up those back muscles. So the rowing machine will actually help to contract that teres minor and infraspinatus. That movement there is very similar to the seated row. That also has to be light, and you can do slightly less on that machine. You can do about 15 minutes of cardio on that machine. That's really going to help too, because it works your arms closer to the heart. Your heart rate's probably going to get up just a little bit higher than that, but try and keep it light, again, between the 112 to 140 beats per minute. What I've got here for a cool down is specifically focusing on the stretches of the quads and the hamstrings, because you have worked the legs there in the squats and lunges. Also into the back because of your seated row, shoulder rotation and lat pull down, and of course the shoulders, which is worked also in the seated row, shoulder rotation and lat pull down. Now, do you have any questions regarding that? No? All right, so we're ready to get started on Jason's program and rehabilitation, getting him to lose the weight. We're looking to lower that blood pressure again and get back into his fit state before he did his shoulder injury.